And failed IVF cycle can create a lot of heartbreak. After all, everyone does an IVF cycle with the hope that's going to be their first and the last. It's going to be successful. Great, doctor. I'm a good patient. I've done everything the doctor told me, taken all the injections. The doctor made a good quality embryo, put it back. Of course, I'm going to get pregnant. And then when the cycle fails, that's major heartbreak. And the reality is, it's actually like a mini death. It's the death of a hope, it's the death of a dream, it's the death of the embryo, it's the death of do I do this again or not? It's the uncertainty. If one cycle fails, where's the certainty that the next cycle will work? It can be extremely difficult to deal with. And that's why it's so important that you prepare for failure. This may sound like a very negative thing to say, but actually, I'm being very optimistic. It's far better to have low realistic expectations than to have unrealistic expectations so that when the cycle fails, you go to pieces and you can't start again. Whereas when you have realistic expectations, you become much more resilient. You can understand what went well, what didn't go well. And the truth is that an IVF cycle is not just a treatment cycle. It's diagnostic. How good are your eggs? Do they form good quality embryos? How good are the sperms? Are they capable of fertilizing? Does your uterus grow well? An IVF cycle provides invaluable diagnostic information which only an IVF cycle can. No other test or technology can provide this information. Please remember that. Not only is this invaluable diagnostic information, it's also valuable prognostic information. If you didn't grow good eggs, then is it worth trying a second cycle with your own eggs, or should you consider plan B or donor eggs? Only an IVF cycle will give you this information. So it is heartbreaking, but always remember, collect as much medical detail about your failed IVF cycle as possible. What drugs were used, what were the ultrasound images, what was your E2 level, what were your embryo photos, what did your embryos look like on day 3, day 5. So that armed with this information, you can analyze what went well, what didn't go well, what can you change the next time to increase your chances of success. Remember, failure is not final. You can learn from it and be better prepared for the next cycle. And often, second cycles are easier because you've been there, done that, and you know exactly what's going to happen. And your doctor also knows what he can do differently to increase your chances of success in the next cycle.